Good afternoon, everyone, or evening, depending on where you're joining us from. Thank you so much for joining us for today's webinar, Radon and Lung Health, What Health Providers Need to Know. We are so excited to hear from our fantastic presenters who bring a wealth of knowledge, expertise, and experience to the radon world. My name is Bethany Dick. I am the Health Promotion Coordinator with Lung Saskatchewan. Lung Sask has been working in radon for over a decade through education and awareness initiatives such as My Radon Story and Tackle Radon, through government advocacy, and through radon testing at homeradon.test.ca. On behalf of the radon team here at Lung Sask, it is my pleasure to welcome you and to host today's presentation. As we gather here today, I want to acknowledge that we are hosting this webinar on Treaty 6 territory, the ancestral and traditional territory of the Cree, Dene, Blackfoot, Saulteaux, Nakota Sioux, and the territory of the Métis. I acknowledge the many First Nation, Métis, and Inuit whose footsteps have marked these lands for generations. This webinar came to be following a cross-Canada survey that we conducted at Lung Sask through InSightrix Research with financial support from Health Canada. Our survey went out to healthcare providers across the country and asked questions about knowledge of radon, the health effects of radon, and healthcare providers' experiences talking to patients about radon. We had some interesting results of our survey. So we found that 83% of healthcare providers rated their own knowledge of radon as fair or poor. 77% of healthcare providers said that the concerns about the health effects of radon were serious. However, only half of respondents could recall that radon is associated with lung cancer. Over half said that they were not very or not at all comfortable speaking with patients about radon, and 2/3 had never spoken to patients about radon. So we asked what we could do to increase knowledge and share information about this important topic that silently affects thousands of Canadians a year, and 86% of respondents were interested in learning more, and 2/3 suggested a webinar to increase knowledge about radon. So here we are. And we're so excited that you've joined us to learn more about radon, its impact on lung health, and how you can support your patients to take action to reduce radon exposure. I would now like to introduce our wonderful presenters. I'll start with Kelley Bush. Since 2008, Health Canada's National Radon Program has made significant strides in educating the public and key stakeholders about radon. They've conducted research to better understand the radon situation in Canada and established the Canadian infrastructure and required resources to take action, test, and mitigate to reduce indoor radon. Kelley Bush has been the manager of the National Radon Outreach Program since 2008 at Health Canada's Radiation Protection Bureau. Prior to joining Health Canada, Kelley worked in the private sector as a marketing and sales management professional in the IT industry. Kelley holds a Bachelor of Commerce with honors in marketing from Concordia University. Next, I'll introduce Dr. Anne-Marie Nicol. Anne-Marie holds a PhD in healthcare and epidemiology from UBC and a master's in environmental studies from York University. She is an associate professor at Simon Fraser University in the Faculty of Health Sciences, where her areas of research include human health risk assessment, environmental health, and knowledge translation. Anne-Marie also works as a knowledge translation scientist at the National Collaborating Centre for Environmental Health, which is supported by the Public Health Agency of Canada. Anne-Marie supports the Healthy Indoor Environments program at BC Lung Foundation to promote policies that improve indoor air quality. She's also a core team member for the Take Action on Radon program. We are so fortunate to have both Kelley and Anne-Marie here to share with us today. I would also like to introduce Carrie Tucker, a lung ambassador from Saskatoon, who has worked with Lung Saskatchewan over the last few years to be able to share her story and experience with radon-induced lung cancer. Carrie will not be presenting today, but she's here with us and will be available to answer questions from the lived experience perspective at the end of the presentation. To kick things off today, we're going to share a short video that tells her story.
My name is Carrie Tucker, and I'm a mother of 3, and I'm a real estate agent, and was recently diagnosed with lung cancer. It was a shock to everyone. My whole family was shocked. I was shocked. I don't tick any of the boxes, as they say, for someone who would have lung cancer, and I've never smoked or anything like that.
I was sitting in the office with Carrie, and the oncologist went over that she had checked all of the markers, and it came back as inconclusive that the only explanation for her lung cancer was radon.
And it's news that most people, as like me, nobody knew about it. Nobody knows anything about radon. to hear that someone was diagnosed with cancer and it's from radon it's shocking news.
About a year ago, I was at an event, an educational seminar, and was introduced to radon. The Lung Association was there speaking on it, and it was really the first I had heard of it or thought of there being any concern about it. And this past summer, I had pneumonia, which caused me to then have a chest x-ray and a follow-up x-ray, and that started the process of thinking there's something more going on here, and eventually was diagnosed with lung cancer.
So you try and be strong for Kerry, and say, well, we gotta work on this. We gotta get it taken care of.
Since her diagnosis, she had taught me about several other stats about lung cancer. Like lung cancer kills twice as many women as breast cancer, which was shocking to me. You don't hear about that in social media or anything like that. And lung cancer was the leading cause of cancer-related deaths in Canada.
Well, I guess all of us were in shock when we were first told, and then Avery and I both know a lot, or a good chunk of what lung cancer could mean. Jordan wouldn't know as much as us, but he understands. Yeah, I guess we were just kind of upset, confused, shocked, all that sort of thing.
And the oncologist said that we really think that this is a concern here with radon, and that's where we, Kerry started working with the Lung Association as well, and got good help and information from them, and good support.
Radon is a gas that you can't see it, you can't smell it, you can't taste it. It's in 1/3 of the homes in Saskatchewan.
Yeah, Saskatchewan has lots of uranium in the soil, and so we naturally have lots of radon under our homes, and it's estimated in Saskatoon that 1 in 4 homes have dangerously high levels, and 1 in 2 in Regina, actually.
So lots of questions go through your mind. But the need to spread the word and get homes tested it's overwhelming. It's coming up in most conversations with your friends and family over the holidays, I'll tell you.
I think radon is out of sight, out of mind. It hasn't had any attention, and all of a sudden it hits us hard, and then you realize that, wow, there's so much of this out there, and the word has to get out.
Just do the test, find out if it's in your house, and take the proper steps from there. Get the kit that tests for the long period of time. Don't do the quick test. Don't be afraid to know what the result is going to be. Because if you can catch it sooner, you're that much better off. If you can get it out of your house and help yourself and the people of your family that live in that home to get it out of your house, do it before it causes any more damage.
My daily life has changed quite a bit now. I'm fighting this cancer, and I look forward to the days of being back to only worrying about the other things. I don't think it ever will go away in the back of my mind, but this can happen to you. And I'm the average girl. I was, mom and working and doing normal things, and it happened to me, and it's preventable. Radon exposure can be reduced in your home, and you can prevent this happening to you. It's not fun to deal with cancer, and no one deserves to have it, but this type of cancer is preventable, and I want people to test their homes and know if they have dangerous levels of radon in their home.
Thank you, Carrie, for always being a champion in lung health, both in Saskatchewan and nationally. I will now turn it over to Kelley, and I invite you as attendees to use the question function in the GoToWebinar tab throughout the presentation, as we will definitely have time for questions at the end. Over to you, Kelley.
Okay, can you hear me okay?
You bet.
And you can see my slide?
Yes.
Awesome, okay. Well, I sort of feel like I don't need to do a good portion of my presentation. That's the first time I saw that video. It's so impactful and so full of good information. There's no harm in repeating it though, because it bears repeating, and it seems that with radon, it's a challenging issue to get people to pay attention to. So repeating the message hopefully leads to behavior change, which is what our overall goal. So first of all, hello everyone. Good afternoon or good evening. My name is Kelley Bush, and I'm the manager of the National Radon Outreach and Engagement Team at Health Canada, and I'm very happy to be here today with you. I'd like to begin by recognizing the importance of the land that we all call home and acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nations peoples and their valuable past and present contributions to Canada. I'm presenting to you today from Ottawa, the unceded, unsurrendered territory of the Anishinaabe Algonquin Nation. So we're going to start with the basics, and some of it was covered a bit in the video. Radon is a radioactive gas that is produced by the breakdown of uranium in soil and rock in the ground. Uranium is everywhere in the Earth's crust. When radon gas is released from the ground into the outdoor air, it's diluted and it's not a concern. However, in enclosed spaces like homes, it can accumulate to high levels and become a risk to the health of you, your family, and your patients. You cannot see or smell radon gas. All homes have some level of radon in them. The question is never if you have it, it's how much, and the only way to know is to test. And most importantly, if the radon level in your home is high, it can be fixed. So as Carrie said, this really is a prevention issue, but people need to know about it and know what to do before they can reduce their risk of radon-induced lung cancer. So there are four major sources of public exposure to natural radiation: cosmic radiation, terrestrial, inhalation, and ingestion. And in addition to that, there are four categories of artificial or man-made sources of radiation: atmospheric testing, such as atomic weapons; medical sources, which you are likely familiar with, X-rays and CTs; industrial sources like density gauges, smoke detectors, and the glow-in-the-dark exit signs that we see in a lot of buildings; and then nuclear fuel cycle power plants. Of all of these sources, both natural and man-made or artificial, it's estimated that radon represents almost 50% of a person's lifetime radiation exposure. So a very significant amount comes from radon. The Canadian guideline for radon is 200 becquerels per cubic meter. In 2006, Health Canada collaborated with our Federal, Provincial, Territorial Radiation Protection Committee to review the health risk from exposure to radon. The risk assessment was based on scientific information from pooled residential radon studies in North America, Europe, and Asia. As a result of this assessment, in 2007, we made the decision to lower the Canadian guideline from 800 to 200 becquerels per cubic meter. In addition to residential homes, this guideline applies to public buildings, workplaces with an occupancy of more than 4 hours per day. So that would include schools, hospitals, long-term care residences, and other indoor workplace settings. So what you see on the screen is a radon risk map of Canada. This map was developed using radon data from our Health Canada Cross Canada residential radon surveys that we've completed over the last 10 years. We estimate that approximately 7% of homes in Canada have high radon, but this percentage varies quite significantly across the country, with some areas estimated to have as much as 50% of homes with high radon. But here's the challenging thing. Whether you live in an area with low or high radon, or if you know that your neighbor tested and found low or high radon, you cannot predict or know what the radon level is in your own home. Again, the only way to know is to do a test. So as you can see on this map, there are no areas of Canada that are radon free. The red to pink color scheme was chosen very specifically to communicate that, and to support our message and recommendation that all homes and buildings should be tested, and of course, mitigated if the levels are high. So where can radon be found? So we talked a little bit about this already, but I wanted to share some recent research that we did. I've mentioned earlier, all homes and buildings that are in contact with the ground will have some radon in them. But one of our senior researchers at Health Canada recently released a publication entitled Risk Assessment for Radon Exposure in Various Indoor Environments. Dr. Jing Chen looked at radon survey data from workplaces, schools, and homes, and found that, on average, radon progeny concentrations in Canadians' homes is 3 times higher than in school and almost 5 times higher than in public buildings and indoor workplaces. In addition to that, Canadian statistics show that most Canadians spend about 70% of their time indoors at home, about 20% indoors away from home, and about 10% outdoors. So due to the relatively higher radon concentration in residential homes and the longer time spent indoors at home, we estimate the exposure at home contributes to about 90% of the radon-induced lung cancer risk. So how does radon get into a house? Several factors can influence the amount of radon that moves from the ground as a gas into the home. The amount of uranium in the ground surrounding your home, the construction type, the foundation condition, the occupant lifestyle, and by that I mean how many doors and windows you have open, and finally the weather as well. The temperature, the winds, and rainfall can all influence how much radon gets into your home. Because radon is a gas, because radon is a gas, it can move easily from the ground into our homes through any small opening it can find, such as cracks and gaps in the foundation floor and walls, around pipes, and in the floor wall joint. You can see in the image on the slide all of the different ways that radon can move from the ground into your home or a building. So what are the health risks? The health risk from radon is long-term and depends on 3 things: how high the radon level is in your home, how long you're exposed to it, and whether or not you're a smoker. Radon is the 2nd leading cause of lung cancer and the #1 cause of lung cancer in non-smokers. Health Canada estimates that more than 3,000 lung cancer deaths a year are radon-induced, which is equivalent to more than 8 people a day. So to speak a little bit more in detail about the health impact of radon, I'm going to hand it over to Dr. Anne-Marie Nicol, and then I'll spend a little bit of time after that talking to you about our National Radon Program. So I'm going to change presenters. Over to you, Anne-Marie.
Can people hear me?
Yes.
Can you see my screen?
Yes.
Okay, excellent. Okay, thank you very much for having me here today. And I am calling in from the unceded territories of the Coast Salish peoples on the Pacific West Coast. You might notice it's still a bit sunny in my room, and that's because the sun hasn't quite gone down here at this point in time. So like Kelley, I hadn't seen Carrie's video before, and I was struck by what a great job LungSask has done in creating that video, because it just got right to the point and said many of the really important things that Kelley has also reiterated and I will touch upon. And what I'm hoping to do here is to present a bit more about the science behind what we know about radon gas exposure and what it does in the body and its relationship to lung cancer. So just to take a small step back, cancer is still and continues to be the leading cause of death in Canada. About 1 in 4 Canadians will die from cancer. That's as of 2021 estimates. We know that approximately 1 in 2 Canadians will develop cancer. And of the cancer deaths in the country, it's very true, as the video noted, that lung continues to be the leading cause of cancer death, far exceeding breast cancer, prostate, and even colorectal. So it is really continues to be a significant burden on the Canadian healthcare system. And just to speak a bit about lung cancer, we know, particularly here in British Columbia, the rates of lung cancer, the age at onset is lowering. So we are seeing younger people develop lung cancer sooner, which really doesn't have much to say about the screening rates, because we don't have the kind of screening, routine screening for lung cancer quite yet that they do in other countries. And the problem as most of you are probably very familiar with the problem of lung cancer, it is relatively low survival rate. So between 15 to 22%, depending on where you are in the country and your risk factors. So heading back to radon, radon, as Kelley noted, is radioactive, and it is a part of the decay chain of uranium. And what's interesting about uranium is that it is a rock until it is radon, and then it is a gas. And the gas phase allows it to move from the ground into other spaces. And then it goes back to being a metal. Uranium is a metal, but it goes back to being metal at the end. So when you see these decay chains, these are metals, this is a gas, and then it plates out as a metal and continues to release radiation as well. So it takes a long time for uranium in the soil to break down. And as was noted, Canada is a uranium-rich country. We still do have uranium mines, including in northern Saskatchewan. But as radon doesn't live quite as long as uranium does, but it kicks off these alpha particles. And this kind of radiation doesn't go very far, but it does contain a large amount of energy. And that's where the problem comes in. So when people breathe in radon gas, it emits the energy as it decays itself in the lungs. And the energy transfer causes damage to the cells that line the lungs. And this is the process that's thought to initiate oncogenesis. So the epidemiology of radon gas is quite interesting and quite different from many of the other carcinogens that we regulate in this country. And that's because the evidence for radon causing lung cancer actually comes from people. It doesn't come from mouse or rat or beagle studies. It's not a lab-based analysis. It was done with the lungs of people, including Canadian miners, who were recruited to look and see what the impact was. They noticed a signal, a lung cancer signal in uranium miners in Europe in the 1930s. And so work began in Canada starting in about the 1970s to recruit workers into studies. And sure enough, there was a very clear relationship between working in a uranium mine and developing lung cancer. There was also pooled residential studies of people who don't work in uranium mines that also confirm this relationship. And interestingly, those minor cohort studies are still continuing. And now we have much better uranium protection. We have a lot more personal protective equipment and ventilation in mines, but there is still a very clear relationship, even at those lower doses, around radon radiation exposure, uranium exposure, radon gas exposure, and then lung cancer, even though we know that these cohorts are not smoking as much as well. So even with modern day mining practices, the relationship is still relatively clear between exposure and outcome. The mechanism of carcinogenicity is still not clear. Radon is associated with all forms of lung cancer at this point in time, although there is research going on to see if there is a specific tumor type that is associated with radon exposure. It's thought to either be a mix of a generation of reactive oxygen species, so leading to oxidative DNA damage, or direct DNA breaks, or both. And the issue with the linear energy transfer is that it is powerful enough to cleave both sides of the DNA, which makes it much harder for the body to repair and much more likely to develop tumors. Also alluded to in the video, and then as Kelley discussed, radon is has a dose-response relationship. The longer you are exposed and the higher the levels are that you are exposed at, the more likely it is for you to develop lung cancer. So there's about a 16% increase in your background rate of developing lung cancer per 100 becquerels. So this is the Canadian guideline. It's 200 becquerels per meters cubed. And you can see here that even at 200, we see a slight increase in the relative risk. The US uses about 148, which is here, and the WHO has proposed down to 100. And there's lots of different reasons why it's 200, it's 300 in some countries in Europe. But what is clear is that the relationship between exposure and outcome increases as the dose level increases over time. Oh, sorry, I've gone backwards. One of the other important risk factors is that if you do smoke and you're exposed to radon, you increase your risk significantly. So this is considered to be a sub-multiplicative relationship. but it increases your risk of developing lung cancer from 1 in 20 to about 1 in 3 if you're a smoker. And there's some interesting research being done right now on people who were ever smokers. So people who have quit, how recently have they had to quit, and how long ago in their past is their smoking history to still see an elevated level of risk. So other risk modifiers. Here's what I found. Oh, sorry. Other risk modifiers are duration of exposure. So I often get asked, how long do I need to be exposed before this is a problem? And right now we really only have the minor cohorts to analyze this from, and they suggest that between 5 to 15 years after exposure is when people can expect to see the onset of a new cancer. This can spread up to 5 to 24 years in other studies. We also get a lot of questions about early life exposure. Are children more at risk? Children tend to spend more time closer to the ground. They have a higher respiration rate. And because we don't intentionally expose people to radon and we haven't really followed up cohorts of children that are exposed, we don't have a clear answer. But what is clear is that the more radiation you're exposed to for longer, the greater your likelihood of developing cancer. That's of all kinds of radiation. So at this point in time, reducing radon exposure when you're young is really a good idea because it lessens the amount of time that you would collect exposure over a lifetime. And unfortunately, not a lot of research has been done on exposure or outcomes by comorbidity. So we don't know if you have COPD or any other underlying condition, if you're more likely to develop lung cancer or not if you've been exposed to radon. There's been some attempts to look at what the burden of radon-related disease is, and in Ontario, this has been done quite nicely by Public Health Ontario. They suggest that of the environmental exposures that develop and contribute to cancer, solar radiation is by far causes the most cases, but it's followed by radon gas, which is really amazing if you think about the issue that most people have not heard of radon gas, because they've heard of many of these other things, air pollution, asbestos, and diesel engine exhaust. So we really need, in many ways, much better public relations or public education to promote the impact that radon is having already in the cancer system in this country. I also often get asked if there's other health effects that radon can cause. And things are being investigated, different, conditions and outcomes. Well, this is a hair trigger. Because radon is soluble in water, there are studies to look at whether or not it's related to gastric cancer. And in the US, there was a report to Congress that suggested about 12% of gastric cancers could be connected to radon exposure through water. And that would be in a well, a private well that someone would have where the water was never exposed to the air. Because if that happens, then once the water reaches the air, the radon will off-gas into the air. So it's a very particular circumstance for people to be exposed via water. You can also inhale it from that water if it comes out of your shower, but that's a much more complicated story we can talk about, or at the question period if people are interested in that. But so far, the studies that have been done mostly have small population sizes, they're ecological in study design, and they lack control populations. Radon and blood cancers, again, because radon is soluble in water, it's also soluble in blood. And there's been very mixed results. They've looked at leukemia and lymphoma and the relationship to radon. And one of the biggest challenges we have is radon measurement. We don't necessarily have good measurement data from people's homes over time so that we can correlate their exposures to their disease. And then radon and COPD has been questioned a few times. The studies are so far inconclusive. There's been a very small number of studies, and a recent meta-analysis suggested that there was no relationship at this point in time. Okay, so I'm going to hand it back over to Kelley to continue on with her, and we welcome questions again at the end.
Okay.
Are you back?
I am back. I'm just trying to remember how to
Yep.
share my screen again. Oh, here it is. Forgive me. Okay. I think you should be seeing my radon exposure risk comparison screen. Is that correct?
Yes, and we did get a question just in the chat saying that they can't see the screen. So I was able to see the screen the whole time when you were presenting, Anne-Marie, but for those who are maybe having some trouble, whether it's your go-to webinar platform or what have you, if you want the slides afterwards, we can definitely send those your way, just if you're not able to see them for some reason. But I have been able to see them all thus far. So I just wanted to quickly interject and say that. So if people need the slides afterwards, we can send them. But go ahead, Kelley.
Okay, thank you. Yeah, thanks, Anne-Marie. I think you did a great job of just really speaking to the health risk that we know, the research that's been done. So despite the fact that it's a significant health risk, that it's preventable, and that there is a lot of research on it, radon is still a very challenging risk communication issue, one that many people just don't worry about. So first, people who don't smoke don't tend to worry about lung cancer. And on top of that, you can't see it, you can't smell it, you can't taste it. It's naturally occurring, so there isn't a bad guy who created it to make you mad or worried. And because the health risk is long-term and not immediate, like something like, for example, carbon monoxide, many people don't believe that radon is a risk that they have to worry about. In an effort to better communicate the risk from radon and get people to pay attention, we try and compare it to other risks that people do worry about or take action on. So what you're seeing on the slide is a chart that compares the risk of dying of radon-induced lung cancer to other better known risks, such as car accidents, carbon monoxide, and house fires. As you can see, the risk from radon-induced lung cancer is significant, but again, the most important thing is preventable. So the simple message is, if you change the batteries in your smoke detector, if you wear a seatbelt, if you have a carbon monoxide detector in your home, then you should also be testing the radon level. So we've talked a lot about what it is, how it impacts our health, and why it's an important issue that and why more Canadians need to know about it. So, but we keep on repeating, you need to test, you need to test. So how do you do that? It's quite simple. You have two options. You can purchase a do-it-yourself test kit, or you can hire a certified radon measurement professional, as is shown on the slide. Whatever option you choose, you need to do a long-term test, and this was mentioned in the video as well. The long-term test, minimum of 3 months, ideally during the fall or winter time when your doors and windows are mostly closed. And we try and make it as simple as possible, so you can go to one resource. Either you can come to Health Canada or call us if you want information about how to test, or you can go to takeactiononradon.ca. So why do we recommend a minimum of 3 months? Long-term testing is important because radon levels vary quite significantly over time. So I mentioned earlier, the Canadian guideline level of 200 is an annual average exposure. What that means is to be able to estimate the annual average exposure level in your home, you need to test for a minimum of 3 months. This will allow you to compare your home's radon result to the guideline level and then determine if you need to reduce the radon level in your home. There are short-term tests available, but we don't recommend them. So again, as you can see from the chart on the slide, radon levels vary quite significantly over time. And if you do a short-term test, it's typically for a couple of days, and that is much more likely to lead to a false positive or a false negative. If you've tested your home and the radon level is above the Canadian guideline, Health Canada recommends that you take action to lower the level. The higher the radon concentration, the sooner action should be taken to reduce those levels to as low as is practically possible. What you see on the screen though, so you go from, I mentioned earlier, it's very hard to get people to pay attention to this issue, they don't worry about it, but if they test and find high levels, then they do get worried. And so it's really important to communicate that you have time to make decisions about reducing the radon level and funding that mitigation, et cetera. So we give these timelines based on the radon level in your own home. Ultimately, it's the choice of each homeowner to decide what level of radon exposure they're willing to accept, because the health risk from radon, and Anne-Marie mentioned this already, while the health risk from radon exposure below the guideline level is small, there's still no level that's considered risk-free. So how do you reduce the radon level in your home? First, it's really important to know that techniques to lower radon levels are effective and can save lives. Radon levels in most homes can be reduced by more than 80 to 90% and can typically be installed in less than a day. systems can be installed in less than a day. So Health Canada recommends that you hire a radon mitigation professional that has been certified under the Canadian National Radon Proficiency Program, and you can see on the slide their logo, and they can help you find the best way to reduce the radon level in your home. The most effective radon reduction method is called active soil depressurization. And this method involves installing a pipe through the foundation floor that leads outside of the house, either at roof line or at ground level, as is demonstrated shown in the image on the slide. What the system does is it draws the radon gas from below the house and exhausts it to the outside before it can enter your home. And then the radon gas quickly gets diluted to low levels outside. Installation of an active soil depressurization system by a CNRP, or Canadian National Radon Proficiency Program certified professional, typically costs between $2,000 and $3,000. Health Canada has developed a radon reduction guide for Canadians that provides detailed information and guidance on what you can do if you have high levels of radon in your home. And this is really important because we're asking you to think about communicating to your patients about radon. We're not asking you to be the expert. We're asking you to make sure they're aware it's an issue, and then they can come to us. We have lots of great information. We have a email address, people who are willing to talk to, talk to individuals on the phone, et cetera. So we're not asking you to become radon experts, just help spread the word. So I'm going to start talking, that sort of ends the overview of what radon is. And really briefly, it's a radioactive gas. It's in every home. You have to test to know if you have a problem. If you do, it can be reduced. So really, it's a health issue about prevention, knowing that radon exists, knowing how it contributes to your lung cancer risk, and then doing something about it. So what I'm going to talk about now is about our National Radon Program, just to give you a little bit of background of the work we're doing under this program. So we lead the National Radon Program here at Health Canada. The program began in 2008 when we changed the guideline level, and it consists of 5 main components. 1, characterizing the extent of the radon problem in Canada through measurement and mapping. 2, technical projects to develop and validate guidance and technologies for radon risk reduction and to transfer that knowledge to industry. 3, research to better understand how radon leads to lung cancer. 4, encouraging adoption of radon risk management practices and relevant policy and legislation. And 5, delivery of radon education and public awareness strategy across Canada. So when we started the National Radon Program, we wanted to lead by example. We were telling Canadians that all homes should be tested, so we launched a federal building testing program, inviting federal departments to test their buildings. Through this program, we tested more than 21,000 buildings. As I mentioned earlier as well, we conducted 2 large-scale cross-Canada residential radon surveys to get a better understanding of radon levels across the country. More than 18,000 homes were tested, and from that, we estimate that approximately 7% of homes in Canada have high radon. As I mentioned earlier, that varies quite significantly across the country. We also worked to have changes made to the 2010 National Building Code to reduce radon infiltration and facilitate the installation of radon reduction system, that active soil depressurization system that I described to you earlier. Because ideally, we're building homes that have less radon in them. So we're continuing to work with relevant authorities and the building industry to encourage even more action and change to future building codes. We have completed radon research in testing and mitigation techniques, granite and building materials, to provide evidence-based policy and public guidance. We also developed some national standards for radon, both in new construction and existing construction, with the Canadian General Standards Board. And of course, we have the delivery of our extensive radon education and awareness program across the country. I'm going to talk just a little bit more about what we do from an outreach and engagement program. So key to the radon outreach and education effort has been the development of targeted programs to reach key audiences and at-risk populations. So of course we have general information for the public that's available for free, both printed and online. We're happy to share those with you, and I'm sure that Bethany will be sharing our radon webpage. But what you see on the screen are Health Canada's priority targeted projects and programs that have had a significant impact in raising awareness and promoting action. So working with public health authorities, educating health professionals, such as we're doing tonight, or today, collaboration with real estate and childcare associations, energy efficiency audit programs, making sure that they know how, as you make a home tighter, which is really important for climate change, you're also potentially increasing the radon level in the home. So they should be letting their clients know about that. And then supporting radon testing through library lending programs, making it more accessible, as well as community radon testing programs. So this is my last slide before we start to have a bit of a discussion if there's any questions, but I wanted to highlight that there is a continuing professional development course available for health professionals. It was developed in collaboration with McMaster University, and it's an accredited continuing professional development program certified for 1 Main Pro Plus credit. It's accredited, it's also an accredited group learning by the Royal College of Physicians and Surgeons of Canada. It's approved by the Canadian Society of Respiratory Therapists for a 1.0 CSRT CPD credit. It's certified by the Canadian Institute for Public Health Inspectors and the l'Ordre des Pharmaciens du Québec. Most importantly, it's easy to access and it's free. It only takes 1 hour to complete and provides you with the research and evidence as well as a case study example. So I encourage you, the link is on the slide, and again, we're happy to share that link in a follow-up email with everyone. So with that, I will take a pause and see if there's any questions.
Awesome. Can you hear me?
Okay,
great. So thank you so much, Kelley and Anne-Marie. It's always such a pleasure to hear, well, first of all, your wealth of knowledge, but also the amazing work that's being done in radon across the country, whether it's education initiatives or research. So thank you so much for being a part of this presentation this evening, afternoon, wherever you are. So there are a couple questions that are coming in through that question function. I would definitely encourage that if anybody has any questions, these are the women to ask. They have so much knowledge about radon, and if you have any questions, like I said, these are the people to ask. As I mentioned at the beginning, we do also have Carrie Tucker here with us this evening, so thank you, Carrie, for joining us. So if anybody does have any questions from that lived experience perspective, Carrie is also here, kind of on standby if those questions come in. But I will start with the first question that came in. It's kind of a two-pronged question. Is there a policy regarding radon testing and rental properties, and who is responsible for testing and rental units?
So I can start, and then Anne-Marie can feel free to add in. So I mentioned a couple times in the presentation that it's a guideline level that we have. So it's actually not enforceable. It's guidance that then can be adopted at other jurisdictional authorities, so at a provincial or municipal level where it may be enforceable. So at this point in time, there is no requirement to test in rental units. We have seen some movement in some provinces where they're looking at their tenancy acts and considering adding a requirement for testing in rental units in contact with the ground and up to the second floor, which is what we would recommend based on the research that we've done in multi-story buildings. Typically, you don't find high radon levels above the second floor. But at this point in time, when we get a call from a tenant who's worried about this issue, we encourage them to consider testing or talk to their landlord. But ultimately, there's not a requirement for it.
Anything to add, Anne-Marie? Okay. Oh, I can't hear you. I'm not sure.
No, we are in BC working to educate landlords and having webinars with both provincial landlords, so BC Housing, for example, and BC, and then talking to private landlords as well. So we're finding lots of interest and willingness to test. We know that radon isn't just a problem in single occupancy homes either with basement suites. It can also be a problem in multi-unit residential buildings, and there's different ways of dealing with it at that point in time, and many of those are rental properties. So there's lots more conversation and research to be done in those kinds of structures as well.
For sure, thank you. Next question, question for Kelley. It says, is the Canada Labour Code being reviewed to require workplace testing?
Yes, good question. Yeah, absolutely. So it's been quite a while that we've encouraged that change. Without getting into too much detail, the radon guideline in the Canada Labour Code is a part of a very large part of the Canada Labour Code that has been in progress of being updated for a number of years. And unfortunately, some of the issues with the pandemic slowed that down. But I did just follow up a week or two ago to see what the status is on that. And I was told that the update to the Canada Labour Code with regards to the radon level lowered to 200 should be gazetted or published in this fall.
Awesome. Oh, another one just came in here. Are there any requirements from employers for disclosing high radon levels, and how soon remediation has to occur?
Again, similar to the earlier question about landlords and tenants. In most cases, there aren't. There may be some, and Anne-Marie, maybe you're a little bit more aware. I have to go back and look. I think there are in some provinces and territories now, or municipalities, where they're requiring it. Certainly, the Canada Labour Code, that is a requirement. And I can tell you through the federal building testing program, the Canada Labour Code still has the old guideline level of 800, but of the 21,000 plus buildings that we tested, a little under 4% had high levels, and the large majority took action to reduce, even though it wasn't necessarily a requirement yet. They knew that that update was coming. But within public buildings, I think there are, but I don't know the details by province. Anne-Marie?
Well, I would like to add that good health and safety practice includes the worker's right to know the things that they're exposed to. And if we treat this like any other workplace carcinogen exposure, you would tell the worker that they were exposed, and then changes would be made. So I believe personally it's on the onus of the employer to ensure that people have a safe working space. And that's been interesting with the pandemic and people working at home, because now you're working in a space where you're more likely to be exposed. And we know lots of people spend a lot more time in their homes. And so the urgency for radon testing has really gone up as a result.
Yeah, absolutely. And I will add, interestingly, there's a number of provinces and territories that have tested some or all of their schools. And the challenging issue with, I think, a lot of air quality issues that they might test is that the large majority will communicate to their staff and to parents in schools if high radon levels are found, which is absolutely important, their right to know. But I just wish they'd also communicate that they tested and found low levels, because that would just, and then promote testing at home, because that would just help add credibility. But oftentimes, because coming out with information about testing creates a lot of questions and anxiety, even if the levels are low, there's a concern with putting that information out there. But I've never seen a situation where they haven't shared results if they were high.
Great, thanks. Okay, next question. What do you recommend we say to patients about radon?
That it's a real thing. It's a health hazard. I think that would be, radon is an exposure that can lead to lung cancer, and that we encourage everyone, like the federal government suggests, that everyone test their home.
Yeah, absolutely. And similar to guidance that you give maybe to new families about things they need to do to ensure their home is a healthy place to live for their families, for their kids. Radon is one of those things that you can bring up to suggest that, as Anne-Marie said, the risk from radon is cumulative. So you really want to make sure that young children are not being exposed to high levels. So talking about that when you're talking to new families is another time you could do it for sure.
Oh, there are resources, simple resources that people can have in their office or their waiting room that can be there for people. And again, it helps normalize and legitimate this exposure as a real thing. I think people are often quite vulnerable to the idea that there's something they can't see or smell or taste and it's bad for them. It's, it's hard for people to acknowledge and accept this. And the more that we make it just a common matter of fact exposure that people need to deal with, like things like asbestos as well, which is often difficult, right, for people to see in any other way. So the more we have people just making it a normal part of a healthy home, the better it's going to be.
For sure. Excellent answer. That's the only questions we've got here in the question tab. So I'll just wait a minute. Maybe there's a couple final ones coming in. But also please note that that there's an email going out tomorrow with my contact information. And if you do have any questions that maybe didn't get asked or that pop into your head, I can definitely forward them to the relevant presenter, and we can try to get you an answer that way as well.
I'd like to add something if that's, oh, is there another question? Okay.
There is.
Okay.
Do you want to, sorry, do you
Oh,
want
go
to
ahead,
add?
ask the question and then I'll add it.
Okay. What more can we do to get family doctors to take radon-induced lung cancer with the seriousness it deserves?
Well, I'm not a family doctor, so I'm probably not the right person to ask. There might be actually other people on the line who, I mean, Kelley's, the course that they have, CME course, is a really good first step to educate people about it. But yeah, that was, well, Kelley, you go ahead and then I'll follow up with my call to action.
Yeah, that's a question I ask myself often. So we do a lot of work with relevant healthcare and medical associations. I think working through public health can have a really a positive impact. So if I think about Ontario and the work we've done with them, initially it was very challenging, to get Ontario to make certain changes. And we started working through the public health authorities, and they were working off the side of their desk for a number of years. But they saw the importance and the relevance of it, and over time collected information and data. And then that led to normalizing the recognition of radon as an issue, especially with data that indicated certain communities had higher levels, and ultimately led to a change in the public health standard. And so again, then you have that trigger, right? You have that legislative or enforceable power, and that enabled the public health authorities across Ontario to be able to make radon a priority rather than just working off the side of their desk, for example. So that's one way, but it's challenging.
Yeah. And so my follow-up to that is that in BC, we've developed a new resource within public health that is an interactive map. And what it allows anyone to do, a realtor, a doctor, anybody, is to show people, because we have some parts of British Columbia that have low radon, and then there's some parts with very high radon. And the people in those places really, in the interior and the north of the province, really need to be taking this seriously. And so that resource is helpful for educating patients, but we're also finding clinicians are interested in doing research. And there's only so much that minor studies of men of a certain age are really going to tell us, right? We need more research, and it would be great if there are research clinicians or people on the line who are interested in doing more clinical work, because we're starting to have enough evidence, at least in BC, where we have exposure databases that are powerful enough to be able to make the kinds of correlations or investigations that make for good epidemiology. And we need more resources like that across the country so that we can explore this in places like Saskatchewan, where obviously there's a lot of uranium and therefore a lot of radon and possibly a lot of disease. But until we can really see what else it might cause, we're going to just keep saying we don't know.
Yeah, absolutely. Okay, another question has come in. Where do I purchase the reliable device for the test if I need to send to the lab to analyze?
So what we recommend is that you go to takeactiononradon.ca, and when you go to that website, you can search by province or by postal code, and you will find a list of vendors who sell test kits or certified professionals who will come to your home and do the test in your area. And everyone that's listed on that website uses certified long-term test kits, which is what we recommend. So that's the easiest way. I will say, there are some people who don't use the internet, and so telling them to go to a website can be complicated. And certainly in those cases, we're very happy to take a call from anyone, and we do have an 800 toll-free number that we can share, and they can call, and we'll talk them through the options on the website and give them a couple phone numbers that they can call.
Awesome.
I'll also make a small pitch for the 100 Test Kit Challenge, which is part of the Take Action program. So we've had community members, including in some cases a nurse, public health nurse, a realtor, come to us and say, I think we need to know more about radon in my community. And we do have a program that operates in the fall to get 100 free test kits into a community just to start a conversation. Doesn't matter what size your community is. We've had them anywhere from like 300 people to 50,000 people. So you still get 100 test kits, but it's a great way to get the ball rolling, to get people testing in a community and talking. And it comes with all sorts of things like free presentations and handouts. And we often get lots of people jumping on board and adding to that and helping to get lots of people testing. So if you're interested in that, that's also on the Take Action. If you think your community could learn a little bit more about their radon levels, then we just need one interested person and off we go.
Awesome. Thank you. Yeah, there's lots of amazing, vendors and programs out there for testing. I think that all across the country, there's lots of great options. And if we're doing shameless pitches, Lung Saskatchewan has homeradon-test.ca as well, which is in both French and English. And we've got wonderful staff here that can help support that as well. Rebecca's always a friendly voice on the phone to help people with their radon questions here at Lung Saskatchewan if you're in our province or really across Canada. So lots of great programs and testing initiatives out there.
Did we talk about the cost? Like the long-term test kits are $40 to $60. I think
30 to 60 even, yeah.
Depending on, you can buy a digital detector. It's about $250, but it is not more accurate than the small puck that Kelley showed in her presentation. So don't let patients get sucked into having to go buy some fancy thing. You really just need that little thing. It's actually the most accurate way to test.
Mm-hmm. For sure. Yeah. Easy and inexpensive.
Mm-hmm.
Awesome. There have been no more questions coming in, but this has been a great question and answer period. Thank you so much again for sharing your knowledge and expertise. And if more questions come in, certainly I can send them your way, but it is getting to that time as well. So thank you so much on behalf of Lung Saskatchewan. Thank you, Kelley, Anne-Marie, and Carrie for always sharing your story. And for sharing your knowledge and time with us this evening, and for your ongoing efforts in radon education and awareness and research. Really, there's so much great work going on. As I mentioned, if you have a question for one of our presenters that we didn't get to, or you didn't have a chance to ask, or pops into your head later, please get in touch with me and I'll forward your question along. My contact information will be included in the follow-up email that you'll receive in the next day or so. This email will also include the recording of the webinar, a few additional radon resources, such as that MAC Health course that Kelley mentioned, and some financial supports available across the country that you can recommend to patients to support radon testing and mitigation. And the slide deck will also be available in both French and English upon request. When you exit this webinar, you'll be prompted to answer a few short questions, and we very much appreciate you taking a couple of minutes to share your feedback with us. So that brings us to the end of our time together. So from the bottom of our lungs, thank you so much for taking time in your day to join us for the webinar, and have a wonderful night, everyone. Thanks so much.
Good night, everyone. Thank you. Thanks, Bethany. Thanks, Anne-Marie.
Bethany.
Thank you.
Thanks, Kelley, that you guys made it easy. So thank you.
Yep. Have a great evening.
Okay.
Bye, everyone.